Hi guys, so I am home and I've calmed down a bit. So, orthodontist this morning, my appointment was at about 9:15, but they left me like 20 minutes, sat in the waiting room. I was like, oh, come on. So I went in and she checked my bite, everything was fine, everything was perfect. So she got the little pliers and plack, 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 and off they came. It wasn't painful. I don't know, they just popped off. But she said sometimes she said when they take the braces off, all the glue will come with it. But sometimes if you've got sticky teeth, which is what she called it, you could have the glue took off a different way. And I have sticky teeth. So she had it's almost like the drill they have at the dentist, but like a little round head. And I don't know, it's like a little nail buffer, I suppose, but a bit harder. So she kind of scratched it off. That was a bit, not painful, but a bit like, well, it's all right. It's hard to describe all these things because they don't hurt, but they're not nice. So that was fine. That was done. Then I got to look at my teeth. So I loved it, of course. Then I had my moulds taken, which I love having my moulds done. I just like all the gooey, squishy bit. And then I went back this afternoon at 10 to 4 to get my retainers, which I nearly just did panic at my mum and dad's because I put them in to show them. I couldn't get the bottom ones out and I was like, oh. So they are pretty cool. Nice and easy. Have my evening meal, brush my teeth, and then put them on, and then that's it till the morning. That's the bottom nut. And then just clean them with water. So that's bottom nut. Push them on. I'll get all done. They feel a bit weird. It gives you a lisp because you can't talk with your teeth covered, so it feels a bit weird. But I'll get used to it, I'm sure. So I hope I've put them in properly. I don't want to push down too hard, but at the same time, I need to make sure they're on properly. But I'll try and take them off there's the top one. They're really tricky. I've got a mirror, so they're so tight. Oh, they're really tight on the bottom. I hope I don't break it. I really hope I don't break them. Fingers crossed. So as for appointments now, I go back and see my surgeon on the 13th of February. So he can do some checks to make sure what he's done is all right. I go back to the orthodontist in 6 months' time, just for a checkup with the retainers, make sure the teeth haven't really moved. And then I will see the surgeon again when I'm 2 years post-op. And then I will be discharged, I guess. So all I need to do now is get these cleaned. So I've got my mirror, I've got my little toothbrushes that I use. Where is it? I got this, and I've got my floss, and I've got loads of toothpaste upstairs, and I think tomorrow I might treat myself to a new toothbrush and get an electric Oral-B one and see what that's like. So that's going to be good fun. So I'm just going to do all my teeth tonight and give them a good old clean. But the orthodontist did say about going to the hygienist because obviously where I've had the braces on for 2 years, I haven't been able to clean between the teeth brilliantly. And she said they've got better tools than what they've got of the orthodontist to get into all the nooks and crannies and give it a good clean. And then I was going to get them whitened, but they're not as bad as I thought they were going to be. So I might see how I go. She also said, because I got that gap, she said in years to come, she said, don't panic about it now. She said the teeth might, because I got one that side and then obviously this one, they might kind of try and close in and bend over and go in the gap. So she said to see to the dentist whether or not they could maybe put a crown cap across the gap just to keep those two separated. So I don't know, we'll see. I've got the dentist in April, I think, so I'll ask then. But other than that, look at it. It's so good. I can't wait to clean them. So yeah, nearly over. Well, it is kind of over. This is still the same. I said it was numb earlier. It is numb, but it's nerve damage now, not anything to do with the anaesthetic. It's just the nerve damage. This is fine, but I do find on cold days, all of my chin and all of my bottom lip will be tingly and numb. On warmer days, normal days, it's just this bit. I'm only fresh off the table still, but if I get any permanent nerve damage, I think it will definitely be here. Everything else is back to normal. Though my orthodontist did say I'm still swollen, but I don't know, my cheeks feel a bit puffy, I suppose, but I think this is still swollen, but I've no idea. But hey ho. So that's about it, guys. So I will catch up with you in a couple of weeks once I've seen the surgeon. And we go from there. We'll see if they look any different. I can't believe how amazing they look. So anybody that's thinking of doing it, do it. Definitely do it. And if you are on your journey, it's so worth it. It's so worth it. Because look at the end result. No overbite. A nice straight tooth. Right, I'll catch you guys later. Bye-bye.